So as last many years, the cancer, diabetes, heart diseases awareness has increased. But considering how the allergy has increased a lot, because we are in the middle stage, like our vaccination has improved a lot, but the pollution is still high, the lifestyle has changed, and because of that, the genetics in allergy has changed. The allergic diseases have come up the ladder, even they are crossing the now cancer and diabetes also. So that's why the allergy, asthma, COPD overlap, we can say. And COPD is the second death causing disease in India. And in that, symptomatically, most of the patients are managed with some of the other therapies. Some patients go to allopathic, Ayurveda, homeopathy, naturopathy, whatever homemade therapies and all. Many of the patients, symptoms wise, they get controlled. Like suppose childhood asthma is there. 80 to 85% of the patients, their symptoms of childhood asthma comes down, but the allergy never goes away. So what does it mean? Basically, it is a systemic disease. Minimal persistent inflammation continues in spite of no obvious symptoms from above. The newer sensitivities development, it always continues. For example, suppose a child had a dust mite sensitivity during the childhood asthma. The asthma has gone, but inside the body, the pollen sensitivities, the insect feather dropping sensitivities, animal dander sensitivity may continue, and later on, these children may have a significant rhinosinusitis, deviated nasal septum, or throat infections, ear problems, or asthma, or vernal keratoconjunctivitis, obstructive sleep apnea like snoring or something. So this minimal persistent inflammation with newer sensitivity formations and later on having a multiple allergen sensitizations or whatever the 3-4 allergens with the significant severity of the sensitizations causes more severe symptoms and the complications of the disease happens, and later on previously whatever the patient was having a response to some simple antihistaminics and all, now they don't respond to the same medications and even not to the antihistaminics. So they are put on the oral or parenteral steroids. Then again, if there is asthma, then nasal steroids, inhaled corticosteroids, nebulizers are at home. If you say like in Pune like city, even 40 to 50% of the parents are having a nebulizer at house. Inhalers are given, homeopathic, Ayurvedic treatments are continued. So what happens? This is in the dormant phase or subclinical stage, and these sensitivities go on increasing. There is minimal persistent inflammation, and one fine day, these patients get triggered by some or the other things because of some lifestyle change or stress or weather change, food change or something, and then they have a significant or any of the disease also. It triggers the allergy, like pregnancy. It triggers some of the 1/3 of the patients have a severe asthma, rhinoconjunctivitis or atopic dermatitis. So it gets triggered then. So this allergic march should be considered while managing these patients. And so what to be done then? See, many medicines, as in previous talks I mentioned about the allergy testing, then biologics and all. But can we do something to prevent this allergic march and sensitivity formations and the severity of the disease? Definitely, there are studies done and last more than 100 years, there is a allergen immunotherapy, desensitization, allergy vaccine shots or tolerance development it is called. So how we give our vaccines to the polio, hepatitis B and all, the same way the allergens are there, the specific allergens like dust mites, pollens, insects, animal danders. These allergens, they cause a specific IgE into the body, and these specific IgEs may increase and they trigger the mast cells, and these mast cells, they release the inflammatory mediators and the symptoms start. So these, once we do the standardized specific IgE skin allergy test or the component resolved diagnosis in few cases, still the gold standard is the standardized skin prick allergy test only. We compare with the histamine positive control and the interpretation with the 3 mm positivity of the histamine, and suppose dust mite are 5 mm, suppose pollens are 6 mm, some of them. We identify that, and then the allergen immunotherapy is given to these patients against these specific Ig allergens. So how it helps then? These purified extracts are given in thousands of dilution, then concentration is slowly increased and up to 1:50 or something. In sublingual, subcutaneous or oral immunotherapy tablets are also available. So once we reach to that concentration, the tolerance to these allergens develops, and these allergens don't cause a trigger to these Ig formations and the mast cells. So specific IgG1, IgG4 antibodies are formed against these specific Ig allergens. So it has been very well established since more than 100 years. The studies have been done, and safety profile is also very good. Even the subcutaneous immunotherapy, only to be cautious, like we don't want to have in a lakhs of patients, 1 or 2 patients may have reactions to that subcutaneous. So they are administered into the hospital or nursing home setups where the emergency facilities are available. Otherwise, sublingual immunotherapy can be given at home also, very safe. Even about 2 years it can be given. Subcutaneous immunotherapy above 5 years can also be given. Even nowadays, among this subcutaneous immunotherapy, the acoride therapies are also available nowadays. They are very safe. The specific like DRP1, DRP2, the extracts are there, and the crude extracts have been removed from that, so that they don't have a cross reactivity, and the reactions to these other additives or the crude extracts should not trigger the reactions. So these acaroids also nowadays used. Even now I am doing a clinical trial on these acaroid in allergic asthma patients above 5 years of children. So these allergen immunotherapy, which is a very well disease modifying therapy, can be utilized to prevent this atopic march, to prevent the newer sensitivity formations, the severity of the disease, the involvement of the other body parts, the comorbidities, and to avoid the complications of the oral or parenteral steroids, which are very well used in India. And not only that, even there are some studies nowadays, it has been found that if the parents are treated properly with the allergen immunotherapy, maybe the severity of the disease is less to the offspring, their children's, and even it can be delayed, the complications also can be delayed along. So as I mentioned, asthma COPD overlap syndrome is very well nowadays, and amongst the asthma, like even in childhood asthma, 85 to 90% of children are having an underlying allergy. Adults with asthma, 65% of them have allergens as a trigger factors. So these patients can have a very good inflammation control, and the disease modifying therapy can be utilized to prevent these severity and the complications. Like we all know, asthma, adult asthma has a secondary infections, pneumonias and all, and then again leading to the COPD, chronic respiratory diseases. Severe asthmas, 30% of may have a cardiac problems also. Then comorbid obstructive sleep apnea will have a respiratory acidosis leading to the strokes or cardiac heart attacks also. So these, considering these all complications and all, the disease modifying therapy approach should be there, like how we have approach in diabetes and blood pressure and cancer therapies, and we are having the best of the therapies, we are using immunotherapy. The same way, allergen immunotherapy, which is not like a immunosuppressant, it is a disease modifying. So basically like a polio and hepatitis B, we are forming the specific IgG1, IgG4 antibodies against this specific Ig. So it can have a long lasting effect. So whatever the studies have been done, some of the studies have shown 28 years of efficacy, some of the studies have shown 35 years of efficacy also. Only thing is that it should be taken for at least 1.5 to 3 to 4 years is the best one. Sublingual immunotherapy, some studies have shown a very good results in 1.5 years also. So it is a long-term therapy, but definitely it is really useful to the community, and it can reduce the abuse of these so many anti-allergics, their side effects, as well as oral and parenteral steroids, and to prevent the complications also.